Introduction to Nutrition and Hydration in Care Settings. What is the aim of this course? This course provides comprehensive knowledge and practical skills on nutrition and hydration within health and social care settings. It is designed to support care professionals in meeting the standards required for safe, person-centered care and compliance with CQC Regulation 14 and NHS Nutrition and Hydration Guidance. Intended audience: health and social care workers, care managers, support staff, and anyone responsible for the well-being of individuals in regulated care environments. Learning outcomes. By the end of this course, learners will be able to explain the principles of good nutrition and hydration and their impact on health, recognize the nutritional needs of different individuals, including older adults and those with specific conditions, identify signs of malnutrition and dehydration and apply appropriate interventions, demonstrate accurate monitoring, documentation, and reporting practices, promote continuous improvement and reflective practice in care settings. Good nutrition and adequate hydration are essential for maintaining health, well-being, and quality of life, particularly for individuals in care settings. For those receiving support in care homes, hospitals, or community services, the provision of balanced meals and regular fluids is more than a daily routine. It is a vital aspect of person-centered care, dignity, and safety. This training course, Nutrition and Hydration in Care Settings, has been designed to equip health and social care professionals with the knowledge, understanding, and practical skills to support individuals' nutritional and hydration needs effectively. Learners will explore the science of nutrition and hydration, how to identify and manage malnutrition and dehydration, and how to apply person-centered strategies that meet individual preferences, cultural needs, and clinical requirements. The course also aligns with national frameworks such as CQC Regulation 14, Meeting Nutritional and Hydration Needs, NHS Nutrition and Hydration Standards, Guidance from the UK Health Security Agency, UKHSA. Throughout this program, you will gain insights into best practices for screening, monitoring, record-keeping, and multidisciplinary collaboration. Each module builds upon the last to ensure you can confidently apply the principles of good nutrition and hydration in real-world care setting. By the end of the course, you will not only understand the importance of food and fluids in promoting health and preventing illness but also be able to implement effective, evidence-based care plans that support individual well-being and regulatory compliance. Important stats. Nearly 45% of all adults screened in UK health and care settings were found to be at risk of disease-related malnutrition. Among residents in care homes, the risk was even higher. Approximately 55% of care home residents were at risk of malnutrition. In older people, 65+, it's estimated that 1 million people in the UK are malnourished, and around 20% of older people are dehydrated. Dehydration in older adults is not just a minor issue, it increases the risk of falls, urinary tract infections, confusion, and loss of independence. Interventions aimed at improving hydration in older or institutionalized adults resulted in an average increase of 300 milliliters per day. Malnutrition has a significant cost to the system. Treating a malnourished person in a care setting can cost 2 to 3 times more than treating someone who is well nourished. Why these matter for care settings? High prevalence of risk means staff in care homes or other care settings must prioritize assessment and monitoring of nutrition and hydration. Hydration is often undervalued but is as critical as food. Fluid deficits lead to major complications. Cost and outcome implications. Good nutrition and hydration help prevent complications, reduce hospital admissions, improve recovery and quality of life. Training such as yours can raise awareness, equip care staff with knowledge and tools to identify and act on risks. Once the final lessons in Module 10, has been completed, you will have the option to take the General Knowledge Multiple Choice Quiz on Nutrition and Hydration in Care Settings in order to receive your certificate, or you can go back and review any of the training material related to this Nutrition and Hydration in Care Settings course and take the quiz later when you feel you are ready to proceed. You have 12 months access to this course once you register, but please note you have 90 days to pass the quiz. This gives you plenty of time to work around your current commitments. Don't worry, you can retake the course quiz if you do not pass first time. The quiz has a minimum 80% correct answer pass rate, and all recognized CPD-accredited certificates are valid for 2 years. You must complete all levels, videos, in this course in order to be able to take the quiz. Please log in or register an account if you are new to FlexiLearnHub in order to do this course. Thank you. This course contains public sector information licensed under the Open Government License version 3.0. Copyright symbol Crown Copyright.